Today's topic is, how does inflammation relate to cancer? This is a question that we receive quite frequently when it comes to nutrition and diet and wellness in general. There's different questions about, does it cause cancer? Is it related to cancer? What are ways that I can reduce inflammation? Different things like that. And because it's such a common question, we wanted to make sure that we incorporated it into our nutrition and wellness for myeloma chapter. And we have Dr. Sarah Lee, as I mentioned, here to speak to us today on that topic. She is a hematologist oncologist who specializes in the care of patients with plasma cell disorders. Before joining Seattle Cancer Care Alliance, she completed a fellowship in hematology oncology at the Cleveland Clinic. Her background also includes experience in researching novel therapies for multiple myeloma, amyloidosis, and other plasma cell disorders. What drew her to Seattle Cancer Care Alliance was the opportunity to participate in clinical research and to embrace a collaborative approach to medicine. Dr. Lee, we're really looking forward to your presentation and excited to have you here. The time is now yours.
Oh, thanks, Audrey. So let's see. We practiced this morning and I'm getting nervous about sharing my screen again. So let's see here. Do that. And then we'll do that. Do we work?
Yep, that's perfect.
Yay. Okay, great.
Awesome.
And then let me hide myself here. I don't need to see myself. Well, good morning, everybody, or at least it's morning here in Seattle. And thank you, Audrey, for the introduction. And thank you to the myeloma crowd and our sponsors for putting together these opportunities for us to connect, even if it's virtually, to kind of talk about these topics and spend these short, little bursts of time kind of addressing these common concerns people have. So like Audrey said, I'm a myeloma specialist at the Seattle Cancer Care Alliance and University of Washington. And I also have a research appointment at the Fred Hutch Cancer Center Research Center, which is part of our kind of alliance here. And we will be talking about inflammation as it relates to cancer today. So just a brief, just a brief outline. We'll talk about, what is inflammation? How is it related to cancer? And then is there anything you can do in particular to decrease inflammation as it pertains to your cancer journey? So what is inflammation? First, I just want to, kind of emphasize or clarify that inflammation is not a bad thing. I think it gets a pretty bad rap, but it's actually a normal process and it's an essential, healthy process that our body undergoes, and it's a sign that it's doing its job. It's important to note that there's different types of inflammation. It can be local or systemic, acute or chronic. And so when people are talking about inflammation, whether that's, your doctors or your dietitian or different people, we all may be talking about different kinds of inflammation, or we may not, when we're talking about it as a generic term, we may not be thinking about it all in the same way. So let's talk about acute inflammation. So again, this is a normal process and it's a response to either an infection or an injury. So you can see kind of in this diagram, kind of the top level of the picture that, there's an injury or infection, and that top level is kind of what we're able to see on the surface, or kind of what we're able to observe. So if you cut yourself or you scrape yourself or there's an infection on your skin, you'll see inflammation occur, and those signs are, redness, warmth, swelling, pain, and heat. And then eventually the area heals. If there was a scrape or something, you might have a scab or something happens, but that area in the skin will heal up. And then your body should return to kind of its normal resting state after healing. Underneath the surface, you could see that there's a lot of activity happening on a cellular level. So when there's damage to the tissue, white blood cells are kind of released into the tissue site from the blood vessels. And that, when the white blood cells get to the site of injury, they start to secrete different signals or chemical signals, things that we call cytokines or chemoattractants, that will then recruit other members of the white blood cells or other members of your immune system to come cause this inflammation, cause the healing, cause, removal of cellular damage or cellular debris. And then eventually you'll get healing. And again, the immune function or that inflammation system should return back to a normal state of healing. In chronic inflammation, this is a long-term immune response to a stressor. And this can ultimately, instead of causing healing, can actually cause damage to healthy tissue. And so there's lots of different causes to chronic inflammation. Those can be infections that, maybe started out as an acute infection, but kept kind of going on, or you kept developing chronic infections. There can be inherited risk factors that predispose you to having chronic inflammation. You can have an abnormal immune response to something. So, in the case of autoimmune diseases, your immune system is having an abnormal response to a normal component of your own body. It can be due to excess weight or obesity or different lifestyle choices like diet, stress, and poor sleep. And what can result with, as a result of that chronic inflammation, can be things like autoimmune disease, cardiovascular disease, diabetes, and of course, what we're going to be talking about and what we worry about is cancer. Now, this concept of inflammation and cancer has been around for many years. It goes as far as back as the 1800s. German physician and scientist, Dr. Virchow, who gave us a lot of our medical knowledge today. He was the first to actually observe that cancer often developed at sites of chronic inflammation. And today we know that as many as 1 in 5 cancers are believed to be either caused or influenced by inflammation. And so some of these conditions or associations that we know of are things like if you have a history of inflammatory bowel disease, like ulcerative colitis or Crohn's, that can predispose you to an increase or increase your potential for developing things like colorectal cancer. H. pylori, which is an infection that can happen in your stomach, certainly if that goes untreated, we know also can predispose or increase risk for things like stomach cancer. Hepatitis B is associated with liver cancer. HIV is associated with lots of multiple cancers, but certainly lymphoma is one of them. And then things like cigarettes or asbestos exposure long-term can also cause things, lots of different cancers, but particularly lung cancer. And so anything that causes inflammation leads to kind of over replication or excessive replication of DNA, because you can imagine if we think back to that picture, there was a lot of activity that's happening. You're trying to clear out that space. So there's a lot of cells that are coming into the area. And so there's a lot of cellular replication that happens. And anytime you're replicating things quickly or in excess, there's always a risk for mistakes or damage that can happen to the DNA. When that happens, you can get production of free radicals, and free radicals in and of itself can cause tissue damage and then further cause DNA damage. And then you get into this loop, which then predisposes you to develop cancers. In chronic inflammation, you also, again, get that cytokine production, which again, cytokines are basically just chemical signals that are part of the inflammatory response that cause other cells, other immune cells to come to that area to kind of work and do what they're supposed to do to kind of help with inflammation. But as part of this, that can cause angiogenesis or development or of new blood vessels. And in part, that's to improve delivery of nutrients and oxygen that the blood supply can bring. But if there is damage to DNA, if there's a formation of, a cancer that's there, as there's more blood vessels, there's more nutrients and oxygen that's being delivered, that's just more fuel or feeding, potentially a tumor base. In multiple myeloma, there's the hypothesis has been made that chronic antigen stimulation or chronic, exposure to something that leads to chronic inflammation or infection may predispose to developing a plasma cell disorder, anywhere from MGUS to multiple myeloma. This ongoing kind of inflammation can cause abnormal immune response and increase the risk of genomic alteration or even genetic instability. Again, that can even, we see potentiate the cause from things like MGUS or smoldering to active myeloma. There still has not been any definitive evidence that infections or oncogenic viruses are a direct cause of myeloma. So similar if we think back to, that the chart that I showed, that H. pylori we know is linked with stomach cancer, or hepatitis B and C are related to liver cancer. We don't have any kind of direct, again, oncogenic viruses or infections that we know are a direct cause of myeloma. Oh. So this picture kind of summarizes what we just discussed. So in that top, first kind of diagram, you have what should be kind of an acute process. If you have an injury or infection to the kind of skin barrier or epithelial barrier, you can have, you see kind of the immediate inflammatory response. You have blood vessels that release the white cells. You get some cytokine release to recruit other parts of the immune system to come. And hopefully you just, get healing of that barrier, and then you can move on. In the setting of chronic inflammation or chronic injury, you could see that in addition to what was first recruited, you have additional immune cells, additional cytokines that are released. And as that process continues, you can ultimately get damage to the DNA. And when that happens, if that continues to happen, again, you see now in the bottom left-hand corner that DNA damage can continue, and that can be a nidus for tumor formation. And you can get, again, increased secretion of different inflammatory markers, different cells that come in. You can then get the formation of blood vessels, and then you can see now how this tumor can grow and grow and grow, and cancers can develop in that way. So there's an interesting paradox that occurs with cancer and inflammation. We talk about how inflammation can cause cancer, and that tumor microenvironment itself can make pro-inflammatory signals, and white blood cells can come, and you see all the damage that can occur. But kind of paradoxically, the cancer actually simulates kind of an anti-inflammatory response systemically. And there's lots of different ways that this can occur. Again, there's signals that the tumor produces may limit the actual inflammatory response from a systemic standpoint. And this is what kind of leads to a more immunocompromised state in oncology and in cancer patients, right? If you have an infection or something, even though you think that there's a lot of inflammation kind of markers that are floating, we've talked about how inflammation is good and it's supposed to heal. All that's directed at the tumor site, and then the tumor site's kind of using your immune system, using that inflammation system to feed itself and not allowing it to do its normal job of surveillance. And therefore you kind of overall have this anti-inflammatory and immunocompromised state. And that's kind of, we're trying to harness this imbalance to, even think about cancer treatments, right? That's one of the rationales for even CAR T treatment now for multiple myeloma, is you're trying to activate and harness the immune system, the normal immune system response to try to fight cancer. So is there anything I can do to decrease inflammation? We get this question a lot, especially because, there's a lot of things I think I hear from my patients when you're diagnosed with myeloma, especially in the beginning. We're throwing all these things at you, 3 drug treatments, all these extra meds you have to take, this infusion, come for this appointment. And you kind of lose control, or you want to be doing things, but you're just kind of following along. And so I think when we talk about what can we do, or is there things I can do, these are ways that patients can kind of feel empowered to make choices that they can do, that they have control over. And so, yes, there are things that you can do to try to decrease inflammation. One of these things, or a big thing, comes with food and inflammation. So what we eat matters. We certainly know that diet choices can impact inflammatory response, and that things like that are affiliated with your diet, so things like excess weight or obesity, actually can increase the risk for myeloma pathogenesis. It can impact your kind of experience through treatment. It can also impact things like risk factors and things that you're going through a bone marrow transplant. So diet certainly makes a big difference. This is a slide that I stole from our dietitian, Carrie McMillan at SCCA. But we're learning, and we know that the gut is actually an immune organ. Studies show that a healthy gut microbiome is actually inseparable from immune health, or your host immune system. And so there is this kind of bidirectional relationship, and the gut microbiome actually can impact your metabolism and immunity. We learn in particular that these short chain fatty acids play an important role in maintaining gut health and metabolic health. And these are a result of kind of microbial fermentation of indigestible carbohydrates like fiber. And they play a key role, again, in the gut microbiome. They're essential for gut integrity. They kind of keep the normal pH of the gut. They help with mucus production. It provides fuel for the epithelial cells which line the gut itself, and it can affect the actual gut immune function. It can also impact metabolism, and so helps regulate things like appetite regulation, your energy, and glucose homeostasis and immunomodulation. And again, we know from, in terms of sugar, people always ask about, sugar feeding cancer and things like that. It's not so much about directly feeding the cancer, but it's about insulin resistance and things like that. And so, again, having kind of this low inflammation diet can help with that sugar homeostasis, or the right balance of that. So foods that increase inflammation, some of them I think are common sense, but I think some can also kind of sneak in there. So certainly processed food and refined foods. So things like white rice, white pasta, pastries, those things are what we consider processed and refined foods. There's chemical foods, so things that might have like sodium nitrate. So those would be things like bacon, sausage, deli meats. Fast food certainly, can increase inflammation. Red meat can also increase inflammation. I think it's a matter of finding that balance, because certain meats can also be good sources of iron. And so you want to limit the intake of it, but certainly you want to be careful of how much you're taking in. Sugary foods, right? So we always think about soda, but cocktail juices itself can have lots of sugar. Coffee drinks, specialty Starbucks drinks can have lots of sugar. Even electrolyte drinks or energy drinks that people might be taking can have a lot of hidden sugars in them. So those are all areas to be kind of careful of. Trans fats, so things with margarine or vegetable shortening, those things certainly can increase inflammation. And then alcohol is also known to increase inflammation. And so those things should all be kind of limited or managed appropriately. So there's an abundance of foods that we can think about that decrease inflammation. We're thinking more along the lines of kind of plant-based foods, vegetables, fruits, spices. There's nutrient-rich and anti-inflammatory herbs and spices, things like ginger, garlic, parsley, cilantro, even turmeric. These are all have been associated with kind of anti-inflammatory properties. Legumes, so beans could be a good source of plant-based protein and antioxidants. Certainly good kind of good oils contain like omega-3 fatty acids, and then certainly just even good water intake, trying to do 6 to 8 glasses a day. When you're thinking about this kind of decreased inflammation or anti-inflammatory diet, so to speak, it's more so focusing on, again, whole foods, maybe plant-based foods. So we know that kind of these plant-based nutrients can serve as antioxidants. Again, they can keep our immune system healthy. They can help with DNA repair, again, all in this kind of anti-inflammatory mindset. And so you don't necessarily have to just be thinking, raw vegetables and raw fruits, but really trying to think, again, in terms of eating more color and incorporating all these things into your diet and trying to keep things in a diverse way. So again, this slide I got from our dietitian, she's always advocating for incorporating, a couple different colors, the more colors you can get on your plate, the better. And then trying to incorporate more of these things, again, through a natural diet. So not so much through supplements and different, vitamins and things like that, but really trying to incorporate this with the foods that you choose, trying to do it in a natural and more of an organic way, so to speak. The American Gut Project was something that looked at different people's guts and what they were taking in. And so one of these things, again, having just taking in fiber as a supplement did not have the same effect as if people who were taking fiber in naturally from a diet, having, more than different 30 types of plants and things per week to try to add that diversity into the gut microbiome. Besides diet, there's other things, we briefly touched on that can affect inflammation and chronic inflammation. So, the American Institute for Cancer Research certainly advocates for, diet choices, certainly, but maintaining a healthy weight, trying to be physically active. I tell patients when you're diagnosed with cancer, it's not the time necessary to go on a diet, right? You don't want to be necessarily restricting calories, but you want to be making these healthy choices, trying to, again, incorporate more whole foods, more color, more plant-based things, trying to be active. You don't have to be running a marathon or lifting weights, but even walking 30 to 60 minutes a day, those would be kind of the things to be considerate of. Again, trying not to get your nutrients through different supplements, but trying to do that in a natural, holistic way through what you're eating food-wise, and then limiting other things. So we talked about limiting processed meats, red meats, alcohol, starches, sweetened drinks, things like that. So again, inflammation is normal. It's a healthy physiological process. It's a sign that our body's doing its job. But certainly chronic inflammation can wear down the immune system. It can make it more susceptible to chronic illnesses, including cancer. There's no guaranteed way to prevent chronic inflammation or to turn it around or to stop it, right? But we can certainly adopt healthy lifestyle choices that can help reduce the effects of chronic inflammation. So again, a diet rich in whole foods, thinking quality over quantity, and then again, managing other extra outside sort things like managing your stress, getting good sleep, trying to be active. Those things are all certainly going to be helpful. So with that, I want to thank the myeloma crowd and all the sponsors for putting this talk together for us, and to all my colleagues, to our myeloma community, and of course to patients and caregivers today.
Thank you so much, Dr. Lee. I really appreciated just the depth that you went into with that presentation, and I loved the different slides that you shared. So thank you for that.
Sure.
One of the things that I found really interesting was when you were explaining the paradox of inflammation triggering cancer, but then the tumor almost tricking the body into being anti-inflammatory. That's fascinating to me. And what an age we live in that we're able to understand kind of the unfortunate genius of that tumor. And anyway, I just appreciate again the depth that you went into. There's several questions being asked, so let's start. And again, if you're unsure of any of the answers, feel free to say that and we can look for sources elsewhere.
Sure.
Andy's wondering if you could comment on the use of curcumin for reduced inflammation with myeloma. She said many folks are following the AMD Anderson protocol of 8 grams a day.
Yeah, I mean, so in general, I think that there's still limited, I think, evidence or data when it comes to different supplements, herbs, spices, other kind of, naturopathic type of remedies or things that people want to do. So I always say, in general, I think it's important to discuss those with your oncologist because it depends on what your treatment is going to be. I also, I'm fortunate where I practice. It's in it's a specialized cancer center, a multidisciplinary group. So we have our own myeloma pharmacists. So it's important to also involve them in what you're taking, and what your chemotherapies are and what kind of interactions there may be. So I don't think that there's necessarily anything wrong with it. I think it depends on what you're taking. And I think, again, I think the evidence is lacking, but if it's not going to hurt what you're doing, I generally say, we work together with patients to do it. Yeah, that's kind of my go-to with all those kinds of things. So, because again, I think it's important. I think that there are things that we can do to decrease inflammation, but even the things that I talked about today, there's some growing evidence about it, but it's hard to replicate some of those things that we might see in on a cellular level based on versus what we're actually experiencing once you take it as a person and what it's doing in terms of progression-free survival or disease outcomes or your response to treatment. And so if there's that disconnect there sometimes of what we're able to see, in a lab or under a test tube versus what is it actually going to be beneficial? But I think that if there's not a harm to it, I think that, again, you talk to your medical team about it.
Yeah, thank you for that. We also had Dr. Terry Golombek. She does MGUS therapy. It's a um, organization in Australia, actually, and she came to speak to this chapter about the role of supplements. So I'll make sure to include that recording in the follow-up email that we send out today. Janet's wondering about about probiotics and if they're helpful for the microbiome and inflammation.
Yeah, so I think it's the same thing. I know I should have paid more attention because Carrie sent me some slides on those things too about the gut microbiome. I think we're learning a lot more about that actually. And I think that's a really fascinating area. We're learning about the gut microbiome as it applies to even transplant outcomes and things like that, and managing infections and what we can do. So it's certainly a very big growing area. I think it's about maintaining that gut health. And so I think prebiotics, probiotics, I know that that's something that's growing, and the dietitian sometimes may recommend those things. So again, I think there could be some benefit to that, to try to maintain the gut microbiome. Especially, we talk about, I talked about, trying to keep it healthy and happy with the foods that we take in. But we do a lot of damage ourselves with, we meaning our as doctors, we can damage that by the antibiotics that we give you, or infections that you may have that require antibiotics that can again damage that gut microbiome and the healthy kind of balance that you're supposed to have. And so I think that there is a role in place for potentially prebiotics or probiotics.
Yeah, thank you. And we, not to keep mentioning other, just there's so many,
No, it's good.
It's a
It's good.
complicated topic.
Yeah.
Dr. Irvi Shaw came and spoke about the importance of the microbiome and how to feed it, and even touched on probiotics. So we'll include that recording as well.
Yeah.
Angela's asking a good question that I've actually shared this question, and I don't know what the data is on this, but she's wondering, how frequent are autoimmune conditions found to be in tandem or as a predecessor to myeloma?
Yeah, so that's a great question, because I see a lot of that's how a lot of people actually find that they have MGUS or smoldering, is that they have an autoimmune condition, and just kind of as routine screening, their rheumatologist may check an SPep every once in a while, and that's kind of how it forms. There is an increased risk, I think, of these plasma cell disorders when you have an autoimmune condition. Again, it goes back to the fact that you have chronic inflammation, right? Autoimmune condition is in a nutshell, you have always a chronic inflammation state. You're in that chronic inflammatory state. And again, anytime you're in that kind of situation where your immune system is kind of working in overdrive more than it should be, it's not able to get back to its resting state. You're constantly trying to make new cells, and there's that high cellular turnover. That's when DNA is replicating, because you need DNA replication to make new cells. And anytime you're making new copies of cells, there's always that risk for a mistake to happen, DNA damage to occur. And that's how cancers start, is a DNA damage. Something happens, one cell picks up a bad copy, and that copy's then replicated over, and that can trigger, right, a cancer formation. And so autoimmune conditions, because that's happening, certainly predisposes you or increases that risk for those mistakes to happen, and certainly something like smoldering or MGUS to occur.
Yeah, it's an interesting research topic. I would love to just learn more about the realities of what that looks like in our patient population. Thank you. Philip just was asking kind of around the same question of, if I've had chronic sinus infections, could this have been a precursor? So I think people are curious about this. So thank you for sharing your thoughts. Connie is wondering, you didn't mention dairy as an inflammatory food, but it's often pointed to as a culprit in terms of inflammation. Do you have any comments, or did the dietitian provide any?
It doesn't necessarily come up. Like, we have handouts, I know, even just from our own cancer center or institute, that of pro-inflammatory and decreased inflammatory foods, and dairy doesn't really particularly come up. I think it's one of those things like with red meat type of thing, where there are some good nutrients that come from dairy products, right? You need calcium, and that's a good way or to get it organically, like through nature, like we're talking about, versus just taking calcium supplements. But I'm sure there's in moderation and kind of limiting potentially the intake of that.
Yeah, because it might have to do with lactose intolerance or even milk allergy as well.
Yeah.
Marilyn is asking, many of us experience bad diarrhea during our treatment. It's super normal, super common, unfortunately. Is this because the drugs are disrupting the gut lining? That's an excellent question.
Yeah, that's a great question. I think that there's probably, I'm sure that plays a part. I think diarrhea with treatment can be multifactorial, and it kind of depends on which drugs we're talking about. So I think, yes, we definitely disrupt the gut lining. We disrupt the gut microbiome. But so, for example, when we're talking about diarrhea or GI related issues, when it comes to like chemotherapy, like with melphalan after transplant, right? We're essentially removing that entire lining because high doses of chemotherapy, like melphalan after transplant, are going directly at cells that rapidly divide. And our gut lining is one of those areas, like our skin, our hair, the cells are always constantly replicating and dividing, right? Because your skin's exposed to everything. You're sloughing off skin every day. It has to repair itself every day. Same thing with our gut lining. And so those areas pick up the chemo that's getting kind of disrupted. And when that happens, the inflammation system is activated. Your gut becomes leaky because all those inflammatory markers are trying to come. And so there's a lot of different factors that play into that. But certainly, yes, I think that certainly plays a part into it.
Awesome. Thank you. There's so many good questions, and our group is so educated. It makes me happy. Judy is wondering if having food sensitivity or several allergies could be classified as, autoimmune, and if there could be a relationship between those kind of allergies and the development of multiple myeloma.
So I don't think, I've not seen or heard anything when it comes of like food allergens being associated with, increased risk for developing a plasma cell disorder. I wouldn't necessarily consider that the same thing as an autoimmune disease. Autoimmune diseases, we're thinking more along the lines of things like lupus, rheumatoid arthritis, psoriasis, those things where you actually have antibodies that are attacking your own body. And so allergens, maybe not necessarily in that same kind of realm.
Interesting. Yeah, we'll have to see as we just learn more about myeloma.
Yeah.
Would a CRP test be a good test to show the degree of inflammation that plays a role in myeloma's progress?
Yeah, so that's a great question. So there's two blood tests. So there's CRP, C-reactive protein, and then there's another blood test called ESR, or the erythrocyte sedimentation rate. Those are two kind of non-specific markers of inflammation. Sometimes doctors, when you're first getting diagnosed, may use that as like a screening lab as well to see if there's inflammation going on. It's, like I said, it's pretty non-specific. So it's not a great, it's not something that we routinely follow as a sign that you're responding to treatment or not responding to treatment. And once you start on the path of treatment, there's lots of different reasons that can that you could have an elevated, marker of inflammation that's not related to your disease. So, we certainly can use them for other situations, but not something that we typically use as a marker of disease activity or treatment response.
Mm-hmm. Thank you. Melissa is wondering if inflammation modifies the genetic composition, can that be reversed somehow?
So, if we're talking about genetic composition, I don't know if genetic composition, you mean like if you have, genetic risk factors that you've inherited, but, I think we talked about that certainly decreasing inflammation can, with foods potentially and things like that, or, can hopefully reduce just the chronic inflammatory state that can predispose you to maybe some of these, to certain cancers and things like that. So yes, you can improve risk factor, or you can reduce the risk factors or likelihood of developing certain cancers by decreasing inflammation.
Okay. I don't know how to pronounce this medicine. I should, but does
Oh,
xylitol,
xylitol.
yeah,
Yeah.
cause inflammation?
I would, it's a sugar, or at least a derivative
Oh,
of a sugar. So I would
okay.
imagine so. Yeah, I would imagine so.
Okay. All right. Um, we have a attendee saying I don't know how to say that.
Monocyte. Oh, yeah, I think I'm seeing
Yeah. Monocytes are always high. Is that because they are fighting the myeloma? And then is there anything to bring them down?
So monocytes are a component of your white blood cell family. So I always tell patients, when you're looking at your blood count panel, there's the total WBC that we look at, but things like your neutrophils, monocytes, eosinophils, but those are all lymphocytes. Those are all members of that white blood cell family. They all play different roles. And so they can be elevated for different reasons. I think it depends on the degree of elevation and kind of what your normal was at the start. Sometimes there can be conditions related to an abnormally high monocyte count. And so if I think that's something to discuss if it's depending on the degree of abnormality. So I couldn't say specifically, but there are conditions associated with abnormally high monocyte counts.
Yeah, that would be something to bring to your treating physician for sure. This is an interesting question. Can silicone implants in the body cause chronic inflammation? Have you heard anything about that?
Yeah. So I think, I've not done a deep dive into this, and I've probably in the same realm heard of cases or things in the news or whatnot. But I think anything that is foreign certainly is a site for chronic inflammation, right? So because your body's trying to take care of or manage that. I think that there have been certainly concerns, with silicones, like if there's historically, I know in terms of if you're getting like breast implants and things with silicone, if there's been leakage, those can be certainly sites of chronic inflammation or even just acute inflammation or acute infections. And so those can certainly, lead to chronic inflammation. But I don't know if just by itself you would say, yes, it's going to, but I think there certainly can be complications to that.
Yeah. Yeah. All right, we have a patient that said, I'm dealing with several Revlimid side effects and considering doing the Whole30 program to clean my gut and slowly reintroduce food. Do you recommend that strategy?
So Revlimid can certainly cause diarrhea, and not necessarily because of diet and things, but because the drug itself. So there's certain antidiarrheal medicines that actually can help specifically with Revlimid related diarrhea, besides just things like Imodium. So there's drugs called, I typically will do something like cholestyramine or Cholestipol. I'm not sure if those have been tried in the past that can help specifically with diarrhea that's related to Revlimid. I think depending on the diet, I would probably, if you have access to maybe a nutritionist or a dietitian at where you're where you're seeing, getting your treatment would be helpful, because with the things that I would worry about is that it's, and from my understanding of Whole30 is you kind of eliminate and add back in, right? And so the elimination part would be a little bit maybe worrisome, again, because you want to make sure that you are not in, limiting yourself from the nutrients that you would need as you're trying to kind of do a cleanse part and then adding things back in. I'd be worried about that. Yeah.
Yeah, that makes sense. Following up with that, Sandy was wondering, does insurance pay for a nutrition expert on the myeloma team?
So I mean, I can't say how other cancer centers operate, but if you're at kind of a designated cancer center, designated cancer institute. So at our institute, we have dietitians that we just send a referral to, and it's part of your cancer care team. And certainly if you're going through a bone marrow transplant or anything like that at those higher level centers, a nutritionist, a dietitian is definitely a part of your team, and they're evaluating you and talking to you about proper diets and all that kind of stuff. So that's already kind of built in. If you don't have access to that, I know that there's I don't know if the myeloma crowd, if you guys have access to that, but I know the Leukemia Lymphoma Society actually has, I think, a a dietitian or some program that you can look into that you can actually get a free consult, I
Wow.
think. And
Okay.
so that'd be a place to start looking if you don't have access to that in your local cancer center.
Yeah, I'll make sure to include that as well.
Yeah.
That's awesome. Okay. Will is wondering if I'll just ask more of a general question than what he's asking, but is black seed oil or sea moss, have you heard of them triggering anything negative?
I've not heard of anything related to those particular compounds. I've heard about like turkey tail recently. That's a no-no, you know, but I've not heard about anything black seed or sea
And
moss.
he's a smoldering patient. So it would be interesting, you know, if you are in the high risk smoldering myeloma patient category on treatment, I would definitely talk to your doctor. And again, everything in moderation.
Yeah.
So.
But that's right. So even in smoldering and MGUS, we always talk about, oh, it's just nothing to do, observation. But these are right, trying to do modifying your lifestyle, trying to incorporate this type of whole food, plant-based diet, limiting your, trying to manage stress and sleep, all ways you can try to prevent chronic inflammation. Those could be active things that you could try to do to, stave off the progression to active myeloma. And I think actually I was looking on the HealthTree site just to see what's been talked about with this. And I think you guys had someone, I forget where, from Memorial Sloan Kettering, and there was some maybe trials about she was doing some clinical trials about in the MGUS and smoldering with diet and things. So maybe something for you to link to, Audrey. But yeah.
We are. So yes, Dr. Shah, who I mentioned earlier, who's at Memorial Sloan Kettering, has dedicated kind of her life mission to studying diet and myeloma progression. Yeah. She's really into the whole food plant-based diet, and she's going to be hosting a study with the myeloma crowd. Should be launching hopefully soon. Within this first half of the year, next 6 months. And it's for smoldering myeloma patients, and it's virtual. So
that's great.
We'll send things out for them. Yeah, thanks for bringing that up. Okay, Carol asked a question, and I might have you jump on to help me pronounce this word because I want to make sure that we get it right. But she says my lactate.
Oh yeah, lactate dehydrogenase.
Thank you. Serum was slightly elevated. How do I know if this is damaged organs or inflammation?
So the LDH or lactate dehydrogenase is, again, one of these kind of non-specific labs that we check. So similarly to what I was saying about ESR or CRP as a non-specific marker, or, it's specific for inflammation, but kind of doesn't pinpoint the cause or why it's there. The LDH is similar. It's kind of a marker for cell turnover. So if there's a lot of cellular activity going on, so you might have a high LDH. So we see that typically, and we use it for myeloma staging when you're first diagnosed, right? So if you have a high LDH, that is one of the markers or one of the labs that we use to calculate your risk, your RISS staging score. It's also something that we may follow if you have a really high burden of disease at the beginning and we're treating you with chemotherapy and we're worried about things like tumor lysis syndrome, where the cells, when a lot of myeloma cells might die all of a sudden, you'll see a high LDH because it's a marker of high cellular turnover. So it's hard to say if just that an elevated LDH, is that from inflammation or organ damage or what's going on just by itself. I think it has to be in the context of what's happening elsewhere with your treatment and where you're in your disease, and the degree of abnormality that there is as well.
Yeah. So definitely follow up with treating physician with that. Awesome. Thank you. Vicky, let's go back to probiotics just for a minute because there's lots of questions about them. Vicky is wondering, do you only take probiotics after taking an antibiotic, or is it good to take daily? So go ahead.
So I think I could follow up with our dietitian to find out too. So, because there's now these prebiotics and there's probiotics. And again, I think in general, when I talk to Carrie and our myeloma dietitians and things, it is really trying to maintain that as much as you can with foods. There's, and so if you can't, and certainly antibiotics will damage that balance in the short term. So potentially in that setting, sure, to take it with antibiotics may be helpful. I don't know still if in the absence of any disruption, if there's still kind of ongoing benefit with that or not. Audrey, I know you said you guys had to talk about that before.
She just said the same thing that you were saying is, prebiotics, probiotics, it's helpful to get probiotics through your food. That's where they want people focusing on eating the rainbow, making sure that they're feeding their body with broccoli and spinach and different foods that provide fermented foods, for example, sauerkraut,
kimchi.
Kimchi. Kimchi. Different foods like that can help with the gut microbiome. And that's where she recommends that her patients focus on, because even in supplements, you can get random things like sugar or sunflower oil or things that are doing the opposite of what you're really trying to do. And they've just been mass produced to make money. So of course, not all of them are like that. I've heard a line is good or whatever, but I think just her point was to concentrate on improving your diet as a whole, because that will do much more for you than taking a pill daily. There's so many good questions. Let's see. Or if there's any questions that you see that you want to answer. Is there any known current medications for multiple myeloma in which curcumin should be avoided?
I don't know off the top of my head.
I haven't heard of any from different people that I've talked with. Okay, let's talk about.
It kind of to touch base on that, I think high doses of vitamin C, sometimes green tea extracts or excess green tea, those things. I know, if you're on medicines like Velcade, you want to avoid. Otherwise, I haven't heard of any other really direct, big, common ones that people take that are contraindicated with some of the chemos that we take. But again, I would cross-check. I always cross-check those with our pharmacists, because there's only so much I can keep up with when it comes to those things.
Yeah. This is an interesting question. I don't know if you've heard anything, but maybe the group has. Is it true that nightshade plants like peppers and tomatoes increase inflammation? That would be
I don't think I've not necessarily. Again, I think it's a matter of moderation, because I would add that into the color group. I would add that, it's vegetables and, adding, and so I think if you're only doing a diet of that, then obviously, probably not ideal, because you're also not getting the variety that we're saying you should get. But I think that I don't think that in kind of a normal intake, if you're adding that into your diet in moderation, I don't think that is going to necessarily be a huge concern.
Let's go back to the Revlimid GI issues. Any idea how long the diarrhea symptoms might last after being off Revlimid?
Usually if it's from Revlimid, I would expect that should resolve as you come off of it. Sometimes you may be, a little bit residual still, but if you go off within 2 to 4 weeks, I would expect that should get better. Generally, if it continues to persist and even beyond that, I think you need to look at other medications, or is there, do you need to see a GI doctor, or do we need to have go in with a colonoscopy or something to evaluate for other causes, right?
Yeah. Awesome. Thank you. Is there anything that can be done to help increase the neutrophils?
Not organically.
What can be done?
There's growth factor shots, right? So it depends on, I'm guessing if you're from treatment, you can become neutropenic from the chemos that we give, certainly. And sometimes it's just part of what we expect with treatment. So, right. So things like Revlimid, like that's what you get that week built in of a break usually when you're on something like RVD, is so that you expect your counts to kind of drop in nadir, and then you get that week off to allow for your counts to rebound back up again. And we don't typically need to check your counts once you're going, but if we were to randomly check it during week 3 or 4, I'd expect that your neutrophil count's going to be kind of lower than you would want it to be, but they should again rebound with the week off. In some cases, if you're exquisitely sensitive to a drug, or even after a lot of lines of chemotherapy, when your bone marrow just can't produce having difficulty with producing regular cells, if you need to, sometimes we'll use growth factors to support, like Neupogen, growth factor shots, or Neulasta to support that white count throughout your treatment to prevent it from dropping too low, or so that you can allow it to go on with the next cycle and you're not having so many breaks from treatment.
Awesome. Thank you.
Yeah.
Let's see. So Connie's saying she read that an elevated alpha-1 protein was an indicator for inflammation, infection, or cancer. Any comment on how one might follow up on such a result?
Again, I think these are kind of one of these, maybe more of a non-specific kind of blood test. If you saw it, you wouldn't necessarily know that it's one thing or the other. The alpha-1 protein can come up on an SPep. So again, if you're being screened for, like, if you have an autoimmune condition, or if there's some concern for a plasma cell disorder, an SPep is getting done, and that's going to show all the different, carrier proteins and things on an SPep test. But what's going to be important from that is more whether or not you have a monoclonal protein, not necessarily kind of some of those other results. So not usually a test that I follow or even see our rheumatologists pay too much attention on if they're thinking about inflammation.
Good to know. How exactly does the lack of adequate fiber affect inflammation?
Say that again, sorry.
It's okay. I kind of stumbled over it. How exactly does the lack of adequate fiber affect inflammation?
So it's if we go back to kind of thinking about the gut microbiome, it's the fiber actually is broken down into those short chain fatty acids, and that's what helps maintain the gut microbiome and is so essential to gut immunity, gut metabolism, all those kinds of things. So it's having a good fiber intake so that you can make those short chain fatty acids. And it's not, again, the fiber intake from the, gut microbiome project shows that it's not just kind of taking in fiber supplements, but the variety of fiber that you can get from, again, whole foods and plant-based diets, having that variety naturally, that seems to really stimulate the benefit of that.
Awesome. Thank you.
Yeah.
You mentioned turkey tail is a no-no. Can you say a little bit more about that?
I think that, let me see, actually, let's see. I think with, the turkey tail, I know can affect kind of blood counts. So make you potentially have lower platelets, can also cause decreased white blood cells. And so I know that's one of the concerns. I think it can also potentially cause some immune issues. I'm not 100% sure on, the other kind of details around that, but just that in general, I've been, when patients talk about to the dietitian, to Carrie and to our folks, that they generally recommend against it. I think it can also interact with some of the other drugs that people are taking. And so I think that's partly what it is. Again, I don't think it's a hard necessarily no. I think it depends on where you are in your treatment, what your treatments are. Same with, the curcumin, all these other things. Again, I don't necessarily think there's a hard and fast no to those things. I think it really depends on where you are in your treatment, what you're taking, what other medications you're taking, and, balancing all those things out with your team.
Yeah, definitely. Dorothy was wondering how about flax or flaxseed as a supplement for fiber. Considering flax is natural, I think that's something that
Mhm.
would be encouraged.
Yeah,
I think chia seeds as
yeah,
well.
those
Do
are
you have any
great sources.
like
Yeah.
those that are easy to put into smoothies or
Hmm.
sandwiches or whatever would be ideal.
Yeah.
um,
So,
sorry, I
and
kind
those
of
are
answered
things,
that one.
no, that's a great, like that's a really great point you bring up though, is because you're trying, I think there's ways you can sneak those things in, right? Because a lot of times, again, we prescribe all these chemotherapies and tell you to eat all these foods, and like you just don't have an appetite, or the chemo messes with your tastes, and you're too tired to do things. But if you can make yourself a smoothie and throw in a bunch of different fruits and sneak in some leafy greens or some vegetables, throw in a scoop of different flaxseed or chia seeds, you can kind of build a nutrient dense drink and sneak things in that way. Or even
Mhm.
like chia seeds, you can kind of, if you're making a salad or something, you can throw that into your salad dressing, and with a little bit good glug of good oils, and that also is another way you can kind of incorporate these things. So it doesn't
Right.
have to be these huge servings of like a plate of broccoli or just things like that, but you can really sneak these things in, and kind of make it a little bit more manageable.
Yeah, definitely. And I think that would be better for your body too, to like slowly adapt over time as you make these changes instead of deciding. I mean, some people can do it cold turkey, but it can also affect your digestive system the other way, that if
Mhm.
all of a sudden you're eating these fiber filled foods that you weren't used to before, then that's going to affect you. And
Right.
actually Marilyn had that question. She said, I've been limiting my fiber rich foods because of the diarrhea. Is this a bad idea?
Yeah. So I think figuring out what the diarrhea is from, right? So again, if it's Revlimid related, is it an infection? Are you on antibiotic? I think,
Mhm.
figuring that source out, and then trying to, again, manage your diet around that. But that's the other thing too, right? We talk about diarrhea, but then if you have constipation from pain meds that you're taking because of your myeloma pain, all these things, it is, again, finding all that balance. So, we talk about all these recommendations, and I know I'm being so kind of non-specific in the answer of these questions, but it really depends, on, again, what each person's going through. And it's hard to kind of just give a blanket statement. And that's why, again, really important that you have a team that you can talk to about these things, that you
Mhm.
have an oncologist that's listening to you. And that has a team that can help, a pharmacist, a dietitian, a nurse, whoever these people are. Because even for where I am, I can't do everything on my own, right? So that's why
Mhm.
I refer it to my team members who can really focus on that. And so, yeah, really important to kind of build your team that way.
I completely agree. Thank you so much, Dr. Lee. We've
Yeah.
reached the end of the hour already. That went by so fast. I'm grateful for the participation and the many questions that were asked, and sorry that we were not able to get to all of the questions. I'm going to end the meeting with just a couple of outro announcements, but thank you, Dr. Lee. We really appreciate you sharing this time with us.
Sure. I hope it was helpful to you
It
guys.
was helpful to me. I learned quite a bit, so I'm sure the patients enjoyed it as well.
Yeah, very good.
Um, Join us next month in the Nutrition and Wellness chapter as we join with our sister organization, the HealthTree Community for AML, as we have experts coming to speak on the power of expression in journaling. We can achieve a higher sense of wellness when we learn how to manage our stress through creative outlets. So that's on April 21st at 6:30 p.m. Eastern, and the link to sign up will be sent out shortly. You may be interested in other myeloma crowd community events we have coming up. Tomorrow is our African American Myeloma Community chapter. We're going to be talking about how to recognize and overcome financial challenges that African Americans face when seeking treatment for cancer. And that's with the financial program manager that we have at HealthTree, Diana Valentine. Tuesday, the 29th at 7 p.m. Eastern is our Myeloma Caregiver chapter. We're going to be doing Finding Rest and Avoiding Burnout in Your Role as a Caregiver, and that's with Alexia Zadok, who is a social worker in Florida at the Sylvester Cancer Comprehensive Clinic. Wednesday, March 30th is at 1 p.m. Eastern, and that's newly diagnosed myeloma patient chapter. We're going to be hearing from a couple, one caregiver, one patient, as they share how they told their family, friends, and loved ones that Tad had cancer. So I'm really looking forward to each of those events, and to sign up for any of those events and even more events that I have not mentioned today is found at the bottom of the slide and will be sent out in the follow-up email, along with all of the other resources we mentioned, which I'm excited to share with you. Thank you so much for helping us build a strong myeloma crowd community. And thank you again to Dr. Lee. I appreciate you all and hope that you have a great rest of your day. Take care, everyone.
Thanks, Audrey. Thanks, everybody.
Bye-bye.